So if a customer comes to us and they're really passionate about some new idea they have for some new therapy, I feed off that. I get right in there with them. I get excited about it, and I wait for Randy, our CTO, to tell me it's not going to work. But then I tell him, well, you're the CTO. You've got to help make it work.
When we get a project in the door, we like to ask for as many technical details as the clients have and are willing to share with us at that time. And these are almost always covered under NDA at that time. That's one of the very first things we do during the sales process, so that both sides feel free and are able to share all their proprietary information that's been developed to date without worrying about what's going to happen to it, regardless of whether we eventually go forward with a project or not. So we ask for all of these technical assets so that we can get a sense for what's new and unique and difficult in this project versus what is more typical engineering. I need to build a power supply that's work, but it's well understood work, versus if I'm building an entirely novel sensing technique that bakes in a lot of proprietary knowledge from the client or from outside sources, that could be quite difficult.
Not only do we get in there technically, but we also allow ourselves to come up and go, okay, do we look at the full picture? Yeah, that thing looks really great, but it costs 10 times more than what it should, and we can't build it. It's not viable. Okay, this other concept looks great, but it won't be viable for 10 more years. Technology's just not there yet, right? Okay, let's compromise, right? So we work with the client to say, okay, where can we compromise? And by the way, if you go with the current indication that you want, you're not gonna be safe. The standards won't let you do that. Oh, well, can we find some literature? Can we do some testing, some feasibility testing to prove out that no, that is, the benefit does outweigh, okay, so we'll kind of tie that in, right? So you're actually introducing viability now. You're actually saying, no, hey, we found a way to make it viable. And look, we brought the cost down so that we can build it, and it's testable.
So we want to be confident that the projects that we work on are actually going to make it into the marketplace and help patients. Market viability, there's a lot of art to that. We work with a lot of startups, even startups that are at the napkin phase of, I've got an idea, no prototype, not an engineer, but here's a therapy that I've determined is going to work. So we have to assess the viability of the company as a going concern. Are they able to raise money? Do they have grant money? Do they have good financial backing? How are they going to pay for all of the expensive services and material required to get something from nothing to an on-market product? I mean, that's many millions of dollars required there. So early stage companies essentially need to convince us the same way they would convince an investor, because we are in a sense investing in their company. If we spend a lot of time just charging for our hours for a product that never sees the light of day, we're diluting our effectiveness in achieving our mission of helping people, changing lives.
You have to be very humble to say, look, we're not the only ones that can teach you this. There's many other very specialized organizations that focus just on viability, compliance, right? They focus just on regulatory, clinical, right? They focus just on manufacturability. And the thing is, as you pick up these different consultants, they're all gonna have different answers. They're not gonna have a unified sort of approach. So you may struggle, right? If you come to Valentium, we can help you tie all those together.